very good morning to you. Thanks for talking to us this morning.
Good
What's
morning.
your view on this expansion of the compensation scheme that the Mayor of London, Sadiq Khan, is announcing today for the ULEZ, the ultra-low emission zone in London? Keir Starmer called for the Mayor to reflect on the scheme. Is this the kind of rethink he wanted?
I think it shows that the Mayor is listening. And Anna, I was glad that you pointed out the health minister, the government minister, talking about when Labour get into power. She seems more complacent than me, I must say. But I think it shows that the Mayor is listening when it comes to getting clean air and those health improvements. You've got to take people with you. You know, I'm sitting here in the Wirral, so obviously we're not directly affected by this issue, but we want good public transport that will help tackle the cost of living. We all know inflation has been a huge problem after 13 years of a Conservative government. So as a Labour opposition, we're working on plans to make sure that if we are lucky enough to be elected, we can help make the economy more secure and bring prices down over the long term. The Bank of England has a job to do on interest rates, separate from us as politicians, but we can make sure that over time the economy is stronger, which will help tackle inflation for everyone everywhere.
But Maria Caulfield was making the point that this kind of expansion of the scrappage scheme just doesn't touch the sides. People are really struggling to pay their bills, and many people just want to see the whole ULEZ scheme scrapped, given that it's such a big cost of living crisis that we're currently going through.
Well, as I said, that's one for the Mayor of London, and I think this morning's announcement does show.
But do you not have a view on it? Keir Starmer has asked the Mayor of London to reflect on it. So what's your take on it?
Sure, and I think that's what's happening today. I think both Keir and Sadiq realise that when it comes to clean air, you've got to bring people with you, and he's showing this morning that he's listening to people. My broader point for the rest of the country is that we all know that when it comes to the environment, whether that is dealing with climate change or making sure that people have got safe, dry, warm homes, we've got to have a plan for that for everyone as well. And that's what we, as Labour, in opposition at the moment, but hoping to be in government, have been working on. And we want that insulation for people's homes. We want to make sure that we can tackle problems in our supply chain so we can help tackle food price inflation, which has been dreadful, and also to make sure that people have got the best job possible, which will mean more money in their pockets. So the bigger plan for our country is about making sure our economy works to help people have an affordable cost of living. What the Mayor is doing this morning is showing, I think, that he's listening to people.
Let me just ask you about the announcement the government's made today about 13 new community diagnostic centres, including 8 privately run ones, which are going to be opened across England. Labour's been calling for more private sector capacity to be used to ease the strain on the NHS. So is this an announcement that you welcome then?
I wish the government had acted sooner. My colleague Wes Streeting has calculated that around 300,000 people, which is about as many people as we have on the Wirral, so it's a huge number of people, could have been helped more easily if the government had done this sooner. And I don't want people to wait in pain. It's as simple as that. And that's why I think the government could have acted sooner. We saw this previously. We, as the opposition, set out a plan to help invest in our health service by getting rid of the non-dom tax break, to have a workforce plan. And late in the day, you know, the Tories have taken that on board. If only they had copied us sooner, I would say. And I think that's true with this. In the end, I think people will ask themselves, after 13 years of Conservative government, do I feel that the NHS has got better and serves us better as a country, or has got worse? And I think the answer to that question is absolutely obvious.
So you want to see more private sector involvement in the NHS. Won't there be someone in the party that will be really worried that this is the thin end of the wedge, that this is creeping privatisation?
I want to see that investment in our health service, as I was just setting out, Anna. We found a way through cancelling the non-DOMS tax break to earmark cash for the NHS, found that way from opposition. When it comes to the record of Labour governments, we've seen investment in our health service, waiting lists fall, staff numbers growing, and crucially, the quality of life for staff in our health service at the moment is really poor. So we need action to make sure that we keep the staff that we've got and we really value them. That's what the last Labour government did. And that's what the next one, if we're lucky enough to be elected, will do. My only point about this government announcement today is that you do have to take these steps when you've got people waiting in pain. And I don't understand why the Tories have waited so long to do it.
But are you uncomfortable? Will you acknowledge that some people might be uncomfortable about this sense of creeping privatisation in the NHS when they see more and more private clinics being used to help out the NHS?
There's lots of areas where we want to grow the health service. I've mentioned our workforce plan, particularly in mental health. We need to grow NHS services. So I understand the point that you're making. People want to see our NHS developed. And that's right, because our health service doesn't just help people have a better quality of life, but it's also absolutely crucial to the well-functioning of our economy, because a healthy workforce means a healthy economy. As I said, the only point about today's announcement is that when you've got waiting lists just absolutely through the roof, as we have got, you cannot have people waiting in pain. And I don't know why the government have been dragging their feet.
Alison McGovern, we appreciate your time. Thanks very much indeed.